Good afternoon. Welcome to this Ask the Expert event focused on sexually transmitted infections and diseases, also known as STIs and STDs. This is an important topic that impacts people of all ages and backgrounds, and one that deserves open, stigma-free conversation. Whether you're looking to protect yourself, understand symptoms, explore treatment options, or just get clarity on facts versus myths, you're in the right place. Today's expert panel will break down the basics, address misconceptions, and answer your questions. Let's meet our panelists. First, we have Dr. Malika Byretti, an infectious disease physician with Mary Washington Infectious Diseases. Dr. Byretti specializes in diagnosing and treating a wide range of infectious diseases, including STIs, and brings deep expertise in patient centered care and public health. Next is Jenny Mahango, an experienced nurse practitioner in infectious disease care. Jenny works closely with patients through testing, diagnosis, and treatment, and is passionate about education and prevention in sexual health. And finally, we're joined by Jessica Bedwell, manager of the wellness program at Mary Washington Healthcare. Jessica leads HIV prevention efforts and works directly with patients and the community to provide access to PrEP, support services, and education, all while helping reduce stigma around HIV and other STIs. Thank you all for being here today. Dr. Byretti, let's start by defining STIs. What are they? How common are they? And what are some common misconceptions?
Hi everyone. Happy to be here. To start off, STIs or sexually transmitted infections are infections that are primarily spread through sexual contact. So STIs can include various things, including chlamydia, gonorrhea, syphilis, herpes, HPV, and HIV, among other things as well. So STIs are pretty common, more common than people would expect. CDC, which is the Center of Disease and Control, estimates that 1 in 5 people in the US has an STI at any given time. So most are treatable and even curable, but the key point here is early detection. Some of the common misconceptions that I hear very often is that you can always tell if someone has an STI, which isn't true. Many of the cases that we have, they're actually asymptomatic. That means that people can carry and spread them without even knowing that they have an STI. Other misconceptions that I hear include only people with multiple partners get STIs. Truth is, anyone who's sexually active can get one, even from one single encounter. And one of the biggest misconceptions is that having an STI is a reflection of someone's character or behavior, and I think that's definitely not true. These are just medical and health conditions, and it needs to be addressed in a manner that conditions like diabetes or high blood pressure gets treated.
Absolutely. Thank you, Dr. Byretti. That's an excellent point. Jenny, I'd like to talk to you a little bit about prevention. What are some of the most effective ways to prevent the spread of STIs?
Hi everyone, I'm Jenny. Happy to be here to talk to you guys about these topics. So one of the biggest things in regards to prevention is condom and dental dam use. They both prevent against STIs, gonorrhea, chlamydia, herpes, HPV, stuff like that. Make sure that you're using them correctly when you put them on. But that's a big way to prevent STIs. The other thing is open communication with your partner or partners, having that discussion. Have you ever had an STI before? When was the last time you got tested? Making sure that you guys talk about regular testing. It's very important to remember that having this open communication is not so much about mistrust, but care, caring for each other's health in regards to sexual health. The other thing also is regular testing is very important, especially with new partners or if you have multiple partners. So, if you have a new partner in your life, just very important that you guys both, have that conversation and get tested before any sexual activity. If you have multiple partners, regular testing is also very important. Like Dr. Breyer already said, a lot of these STIs can be asymptomatic. So you or your partner or partners may not even know that you have gonorrhea or chlamydia or something like that. Lastly, we do have vaccines. So we have vaccines against hepatitis B, which can be sexually transmitted because it can be transmitted through blood or body fluids. And then we also have the human papillomavirus or HPV vaccine that can be given started at the age of 9. Most folks start around 11 to 12, but it prevents against HPV, which causes cervical, vulvar, penile, oropharyngeal cancers. And this vaccine actually helps prevent 90% of these cancers caused by some of these, high cancer strain HPV strains. So we do have 2 vaccines that help prevent STIs, thankfully.
That's great news. I'd heard of the both of those vaccines, but I didn't realize what all they treated against, so or
Yes.
prevented. That's amazing.
Yes.
Um, Jessica, you work closely with HIV education and prevention. Can you tell us more about PrEP and other tools available to reduce HIV transmission?
Sure. I'm excited to be here as well and joining Jenny and Dr. Byretti. They talked about some really great tools and information about STIs. The wellness program has a lot of those tools here at our fingertips to provide to the community, like education and free condoms. You can go on our website at wellness.mwhc.com and request those items be shipped to you for free, as well as educating the community. Our staff do a lot to educate and empower the community to make informed decisions about their sexual health. With PrEP, it stands for pre-exposure prophylaxis. Pre meaning before, exposure meaning contact, and prophylaxis meaning prevention. So basically, PrEP is a medication that you can take as part of your routine before you're exposed to HIV to help reduce the chances of getting it. So much like I like to refer to it almost like birth control, like folks that take birth control, they're preventing pregnancy. When you take PrEP, you're preventing HIV. There's also PEP or post-exposure prophylaxis, and that is what it means is you're taking a medication regimen after you're exposed or possibly exposed to HIV. It's important to take that within 72 hours and and get the right labs and continue to get tested after taking it. And then also just knowing your status of all STIs. Um, you again make an empowered decision, an informed decision when you know your status and you can support your partner's status as well.
Yeah, that's definitely great advice. Get tested and know your status so you can move forward with confidence and know what to expect. So, Dr. Byretti, when we're talking about STIs, what are some signs and symptoms to look out for? And I know you said that some people can be asymptomatic with certain things. So, tell us a little bit more about that.
Yes. So I do want to reiterate and I do want to emphasize that people can definitely be asymptomatic, have no abnormal symptoms, but still have an STI. I think that is important, especially in terms of getting routine testing and screening. And that is why that is really important to make sure that you're aware, as Jessica was saying, of knowing what your status is in terms of not only just HIV, but also your other STI status as well. But when symptoms do appear, they usually include things like unusual discharge, genital discharge, sores, itching, burning during urination, pelvic pain, pain during sex. All of these could be representative of STI that you may have. And also the timing of these symptoms, right? Symptoms can appear sometimes within days of exposure, sometimes can take weeks or even months at times. So it's not necessarily indicative just because you're 1 week out from an unprotected exposure that you are out of the window of having an STI because you didn't have any symptoms. Sometimes it can also present at a later time as well, which is a good thing to keep in mind. And yeah, which is again why I want to emphasize the importance of routine STI testing, which I think Jenny will go over later as to what those are.
Yeah, absolutely. Jenny, would you like to kind of walk us through what to expect with an STI test? Like, can we expect it to be painful or embarrassing or any of those things?
So they're pretty easy. They're, quick in and out, they're painless. You can expect probably an oral swab. We're checking for any STIs in the back of the throat. Also a urine test can also be done to check for certain STIs. Pending, depending what kind of intercourse you're having, we may do some vaginal swabs or rectal swabs to check for STIs in those locations. And those are pretty quick and easy. Very important, when you speak to your provider about sexual health and STI testing, be very open with us. When we ask questions, it's not because we're trying to be nosy. We really just need to assess your risk factor and find out exactly what we need to test for in that instant. So, just having that open communication with your provider is super important. And then also, just getting tested is empowering. You're making a choice to, you know, basically care for yourself and other folks as well. Sexual health is something that not a lot of people talk about, but it's very important, especially when it comes to protecting yourself and others, preventing transmission with other folks, preventing complications from STIs later on down the road. But, it's testing, very easy. Please feel free to talk to your provider about it. If there is any concern, if you had unprotected intercourse, please go ahead and get tested. I promise it's painless, it's easy, quick in and out, and your provider is going to keep everything confidential.
That's great to hear that it is relatively non-invasive. I mean, an oral swab is nothing, right? So that's great to know. So, Jessica, I want to talk a little bit about the stigma that surrounds STIs and STDs. I feel like we all kind of know that that's the case sometimes, and although it shouldn't be at all. So, tell us why it's important that people talk openly about sexual health, about STIs, about getting tested. Why is it important that we talk about that?
Sure. Stigma of STIs prevents people from getting tested or treated because of the fear of judgment, the fear of um, feeling like they did something morally wrong, which that will prevent you from stepping into your doctor's office asking for these STIs or even talking about the symptoms. We like to talk to our patients a lot about, if you don't tell your doctors what's going on, they can't treat you, they can't provide the best education, the best tools, the best medication for you and support you through those decisions. So it's really important for us to normalize these kinds of conversations. And when it comes to sexual health, um, it's going to lead to better health outcomes for not only you but for our community. Um, when someone walks around not knowing their status of their STIs, they can unknowingly share those STIs with others. So it's really important for you to be open and honest with your providers. And
Yeah.
I will add as well, we at the Wellness Program provide free HIV testing, and it's as simple as a finger prick of blood, and you get your results within minutes. And that is completely free.
Yeah, that's amazing. And if you're interested in doing that, you can visit wellness.nwhc.com and there's more information there. But I love what you're saying that STIs are like any other health condition, they are a health issue, not a moral failing. It doesn't mean that you did anything wrong, doesn't mean anything about your character whatsoever at all. It's just like being diagnosed with the flu. Like you
Absolutely.
were exposed to
Mhm.
something, you need to be treated, and that's
Yes.
that. And talking about this really, really normalizes it. And I would imagine that you guys are very used to having these conversations, so you know how to make it not awkward when a patient is
Yes.
asking questions about this. So I think that that's really encouraging to people who have questions about this. So let's move on to our Q&A section. So we've rounded up some of the most frequently asked questions about sexually transmitted infections. And I'd like to ask you guys your answers for these. So Dr. Byretti, tell us, are STIs always transmitted sexually?
Um, that's a good question. That's not always the case. While most STIs are primarily transmitted through sexual contact, it can spread through other ways as well. For instance, herpes or HPV can be transmitted through skin-to-skin contact, even without intercourse. So that's one of the reasons why condoms reduce risk, but don't offer 100% protection when it comes to this. So again, it's very important to just keep up with routine screenings and testing for that reason. But there's others like HIV, and I want to include hepatitis B and C in this as well, even though, we're focusing on STIs, because those can be transmitted through blood or sharing of needles. And things like HIV and syphilis can also be transmitted from mother to baby during childbirth, which is why it's routinely emphasized that during pregnancy, they should be tested for STIs.
Wonderful. And I have a silly question for you, but can you get an STI from sitting on a public toilet seat?
You cannot.
Good to
It has, yeah, I'll just end it there. You
know. Good to know. Good to
No
know.
worries.
We're
Very
asking the
common
hard-hitting
question.
questions.
Yeah.
So again, Dr. Byretti, for you, what should someone do? What's the first thing you should do if you test positive for an STI?
First of all, I would like to say don't panic. Like I had mentioned before, it is a very common diagnosis. More than 20% of the population in the United States do at some point have an STI. And most are treatable and even curable. And so one of the first things, if you test positive, it's important to follow up with your healthcare provider, whether it be your PCP, infectious disease, or anyone that can confirm that diagnosis and start treatment if it's indicated. And I would say that if you're offered treatment, to complete and take the full course of the medication as prescribed. Even if you feel better halfway through the course, I would recommend completing the full course, because that's what's going to completely eradicate the infection. And incomplete treatment of STIs can actually lead to resistance and harder to treat as if it comes back later. Also, I would recommend avoiding sexual contact until cleared by your provider to prevent any spread of the infection if it's active. And also, speaking of, I would also let your partners, your previous sexual partners, whoever might have been exposed, to also know so that they can get tested. I think that's probably the hardest part for a lot of people when they do test positive for STI, is to reach out and let other people that might have been in contact be aware of the diagnosis, only because I do think it is probably the most crucial part to prevent spread of the infection in the community as well. And I would also recommend getting retested if it's recommended, and to just keep up with routine screening going forward.
Perfect. That's great advice. Um, how far back do you feel like you should go when you're telling your partners or your previous partners? Should you go back years, months, weeks? What do you think?
I would say, I think general rule of thumb is usually, I don't know, the last couple months, last sexual encounter. First of all, I would go back to when that last unprotected sexual encounter was, or where that risk factor you think was when you first got the STI. Some people have a good idea as to when that is usually, if you ask. And then I would say anything going forward from that initial encounter. If you don't know, I would say at least a few months back, just because I said a lot of these infections sometimes can stay dormant and don't show up till like a week, a month later sometimes. So you never know if it was the most recent exposure, if it's something beforehand that you might have gotten.
Yeah. As a follow-up question to that, do you have any advice for how to have that conversation? Is it better to have it in person? Is it better to call them up on the phone? Do you have to be super specific about what type of STI it is, or can you just say, hey, you might want to get tested?
So the mode of communication is entirely dependent on the patient and their comfort level in how they're going to interact with that person. If it's over the phone, over text, in person, it doesn't matter to me as long as that communication gets relayed. And as to what specific type of information you have to give out, I would keep it as general or as vague as you feel comfortable with. You can just recommend them to get screened for an STI panel, make sure that, be like, hey, like there was an exposure. I am concerned. I would recommend for you to get tested for your own safety and well-being. That's where you have to leave it at. You don't have to say exactly, what particular STI that needs to be tested for or anything like that.
Perfect. Thank you. That's great advice. Jenny, can you tell us how often, I think we touched on this, but just so
Yeah.
we're all clear, how
Yeah.
often should someone get tested for an STI?
So the usual recommendation is if you're sexually active, at least once a year. But there are certain risk factors involved that may increase your risk in regards to acquiring an STI. So, for example, if you are, with a new partner, go ahead and get tested before you engage in intercourse with your new partner. If you have multiple partners, you probably should get tested at least every 3 to 6 months, usually closer to every 3 months. Um, Certain communities, such as, men that have sex with men, usually the recommendation is 3 to 6 months. Persons living with HIV, about 3 to 6 months. If you are a sex worker or you engage in intercourse with a sex worker, then about 3 to 6 months. Also, if you have certain occupational exposures where you may be exposed to, body fluids or blood. If you do get exposed, go ahead and get tested. But for the most part, usually about 3 to 6 months is the recommendation, especially if you have multiple partners or if you're in a high risk group.
Great. And when you decide to go get tested, do you need to see your primary care doctor, or are there other options for going to be tested? How can you do it sort of not anonymously, but
Yeah. So primary care is totally fine. Health departments, there are certain health departments that have certain days where they just do STI testing. So you can call and find out when they do that. A lot of urgent cares also do STI testing. So that would also be a good option. Or, if you infectious disease is totally fine as well. We do a lot of STI testing as well, especially through the wellness program, like Jess said. We do have HIV testing through the wellness program.
awesome. Another question for you, Jenny. Is it possible to get the same STI more than once?
Yes, it is. I do see that very frequently in practice. This is why routine screening is very, very, very important. You can acquire the same STI again, and you can also get it in different locations. So just because you had, urethral gonorrhea chlamydia doesn't mean, you can't get it anywhere else. You can also get it in the throat. You can also get rectal STIs. So, when it comes to testing, when we ask certain questions, this kind of gives us a better idea of where to test, and it is, it allows us to assess your risk factors. So you can get it again, and it's not always in the same location.
Why did I not realize that you could get an STI in your throat? I didn't
It's
realize that.
Yes, it is. Most people do not know that, and most cases of rectal and pharyngeal gonorrhea, chlamydia are completely asymptomatic. Um, Quite a few times, every time my patients come in, I do ask them if they want to go ahead and get tested. the number one thing is, well, I don't have any symptoms. That's always the response I get. I would know if I have an STI, but most cases, you are completely asymptomatic, meaning you have no symptoms. So, like Dr. Briaretti and Jessica said, that increases the risk of transmission in the community. So, routine testing, very important. You can get it
Yeah.
again. Yes, it's possible.
It sounds very important. And I have a follow-up
Yes.
question for you, Jenny, and also Dr.
Yeah.
Byretti, if you wanna chime in. Um, oh gosh, I had such a good question and it just left my brain entirely.
Can I ask a question?
Yes, please.
A
Yeah.
follow-up question.
Yeah.
So Dr. Byretti and Jenny, can you speak to what some people might think they have outside of STI? For instance, HIV, what does HIV look like initially when you first contract it?
Um,
Um,
yeah.
so go ahead, Jenny.
Yeah, so acute HIV, like when before you're diagnosed, some of the symptoms that you usually can see are kind of like flu-like symptoms. So, fevers, chills, night sweats, nausea, vomiting, diarrhea. Sometimes you do develop a rash. That's another symptom to be very aware of. But those are the kind of the things that most people present with in the initial acute phase when you're first infected. So a lot of times it can get mistaken for a cold or a flu. So that's why it's very important to talk to your provider about your sexual history. And if they ask you those kind of questions, be very open with them, because if not, I have seen certain instances where it initially gets diagnosed as like a flu, and then later on the patient, had HIV.
And we
Uh,
just came out of flu season, so
yes,
that might
yes,
be the case for some
yeah.
people
And,
listening.
and if I'm allowed to kind of like, kind of share like, you know, um, I actually had a patient that was just newly diagnosed a few months ago, and he had actually gone to the ER and he had, flu-like symptoms and everything was negative. It's totally fine. They told him to go home, supportive care. He knew that he had been engaging in high-risk sexual activity, was a little concerned. So he went to urgent care a few days later, asked for HIV testing, and it ended up being positive. So, just something to, keep in the back of your head, when you're talking to your providers and they ask you these questions, or even just bring it up, just be like, hey, is there a possibility that it could be this?
And I think that story especially also highlights the importance of just patient education and advocacy for
Yes.
your own health, because the fact
Yes.
that he was able to go back because he was still concerned and ask for that testing is commendable.
Yes. Yeah. Yeah.
Absolutely. That's great information. And I did think of the question that just escaped my brain. What happens if an STI is left untreated? Can they progress? Can they get worse? What happens?
Yeah, sometimes if an STI gets untreated, it can definitely progress, right? It can involve other organs, it can lead to more of a systemic infection. Sometimes things like, for instance, let's take syphilis, it can come in different stages, it can affect your other systems. There's different stages of infection. It can affect your nervous system. It can affect even things like walking can be affected if syphilis goes untreated for a very long time, and it can progress to all of these other tertiary uh, organs. It can affect your eyes, it can affect your hearing. There's so many different things, and even things like HIV, obviously, if that's not detected and goes untreated for a very long time, it can lead to many other complications down the line. It can make you disposed to a lot of medical conditions, a lot of immunocompromising conditions like co-infections like tuberculosis and other things like that. So I do think that if an STI does not get treated appropriately and in time, it can lead to later manifestations and complications as well.
So just another reason to underscore why it's important to get tested and get treated, do all those things as soon as possible. Jessica, I have a question for you. You mentioned PrEP earlier. I'd love to talk a little bit more about what PrEP is, who should consider taking it, what the process of taking it is like. Can you share a little bit more about that?
Sure. So I definitely think before you start PrEP, you need to talk to your providers and learn and educate yourself as much as possible. I know Dr. Beretti and Jenny can talk about um, the possible risk factors for those who should not be on PrEP. However, those who should be on PrEP are the ones that Jenny was talking about, those that have multiple partners that may not know their status or they don't know their partner's status. Um, and those who just want to empower themselves and make the best decisions for their health should consider PrEP. Um, there's several options now, the pill form and also the injection. So, and there's so many resources out there now for copay assistance. HIV and HIV prevention medication is very expensive. However, the pharmaceutical companies have made several options to support, like I said, copays and financial assistance.
That's great information to know. I was thinking, I wonder if the insurance companies cover that kind of stuff. So that's great. And that's something that you can help point people in the right direction in terms of the copay assistance programs.
Sure. Yeah,
Awesome.
absolutely. If you want to reach out to our office or go online, we can definitely do that. Or reach out to the pharmaceutical company whose medication they're making.
Great. Jessica, I'd like to talk to you a little bit about common myths surrounding HIV. We want to clear up the myths. We want to break the stigma, talk about these important things. So tell us a little bit about some common myths that you hear and whether they're true or not.
So I want to put out there that HIV has no bias. We no bias against gender, race, ethnicity, age. We have folks from teenage all the way up to we serve community members from teenagers all the way up until folks in their 90s. Um, with that being said, it's also not a death sentence anymore or considered a death sentence because of the medical advances and the just the knowledge. Just being in care, staying in care is going to be the most important thing for you as a person living with HIV. Um, and finding support, whether it be in your doctor's office, at the wellness program, with your family and friends, finding somebody who will support you through this journey and help you stay motivated to stay in care will get you into your 90s living a long and prosperous life or healthy life.
I would also like to add on to that too, in terms of I think a lot of people are sometimes misinformed about the treatment of HIV, right? I know, like Jessica was saying, that there has been just major advancements in treatment of HIV. It doesn't involve multiple pills multiple times a day. There isn't a huge pill burden anymore. Right now, where we're at, you can treat HIV with one pill a day, even, considering other factors. But most of our patients are on one pill a day that they just have to take every day. And that's as simple as popping in an Advil if you need it. Like, so it's not an increased burden of treatment either to have HIV controlled, which I think people are starting to understand now, and it's not like what it was 20 years ago.
Absolutely. I've heard several providers say it's easier to manage than diabetes. It's a lot of our folks are on one pill and they love it, or they're on the injection once every 2 months and they
Yeah.
love that. But it's really important just to talk to your provider about what's best for you and your lifestyle.
Yeah.
So when
Yeah.
a patient I'm sorry, Jenny, go ahead.
Sorry. So the other
Go
thing I
ahead.
wanted to kind of touch on that too, because I see it a lot in practice, especially with like my new diagnosis patients, like a lot of the sentiment I hear is like, I'm never going to have a normal life. Like, especially my younger folks, like, I'm never going to be able to like have kids or get married. Like, no, you can have a long, beautiful life and live with HIV. I see it every single day that I go to work. If you're taking your medicine and you stay in care, you will live a long, beautiful life just like everybody else.
I love
And
that.
can have
That's
children.
Yeah, you can have children too.
well, that was my next question is
Mhm.
if you're in care and you're being treated for HIV, can you still spread HIV?
If you are taking your medicine
Mm-hmm.
and you are virally suppressed, technically, correct me if I'm wrong, Dr. Already, but you should not be able to spread HIV if you are virally suppressed. So that's why it's important to take your medication. And that is the goal with HIV care, is to make sure that, our patients are staying on their medications. They're coming to see us, every 3 to 6 months, checking viral loads, making sure that their immune system is working well. But if as long as you're taking your medication, you should be, and you're virally suppressed, you should not be able to spread it to anybody else. Yeah. And I have a lot of patients that have, that they have significant others, they have kids, normal life just like everybody else living with HIV.
And one of the slogans of that we tend to share with a lot of our patients is U equals U,
Mhm.
which is undetectable equals untransmissible. So it's more
Yes.
motivation for them to stay compliant and have those viral loads be, as low as possible, as undetectable as possible, because that means that, the likelihood of them transmitting HIV is unlikely.
Yeah.
And we have a lot of couples where one person is HIV positive and the other isn't, and the one that isn't will start on PrEP. So there's another purpose for PrEP, is just to have that extra layer of safety. Um, but I wanted to add to PrEP will only protect you from contracting HIV and not other STIs. So that's why it's important to combine PrEP with condoms if you are engaging in um, with multiple partners.
Yes.
That's a great point to make. Um, Gosh, I've learned so much today. And you guys listening to you talk about this, it really feels like a very hopeful conversation. This is not, like you said, a death sentence. It's not a moral failing. Like it's just like anything else. You have an infection, you have some, a health issue that you need to treat, and then you move on with your happy, healthy life.
Yes.
That's amazing. I love to hear it. Um, we're almost at our time for today, so I want to give you each an opportunity before we wrap up. If there's anything else that you'd like to share or anything you'd like to say to our viewers who are considering getting tested, please do so.
I think the main takeaway from today is just to again reemphasize the importance of just routine screenings and testing. I think Jenny had went over, like about the timeline about how frequent to do these testings. If you feel like if you just had an unprotected encounter, feel free to get tested in a week or 2 weeks, no matter how often it is. It's really dependent on what you're comfortable with and what you think your risk factors are. But I do think screening is going to be crucial in managing this and your health going forward.
Absolutely. And I would add to that, I love Jenny's example, and Dr. Byretti noted it well, is the patient who was empowered to ask more questions and ask for testing, educating yourself as much as possible, because we're all human. Doctors don't know everything, or ER staff don't know everything. So don't be ashamed or don't be scared to ask for those tests, even if they are not recommending them. We have seen some folks come to us who will get syphilis testing or gonorrhea and chlamydia testing, but not HIV testing. So just making sure you're empowered and knowing what's happening with your health.
Yeah. And to add on to that, Jess, like, let's say that let's go to urgent care and they test you for gonorrhea, chlamydia, and syphilis. If you would like to get tested for HIV at that time, tell the provider, be like, hey, I'm here for STI testing. Let's do an HIV test. Your risk of acquiring HIV does increase when you acquire STIs. So it's one of those things that definitely make sure you get tested for that if you do have an STI, just to be on the safe side. Other thing I want to add is just, also making, talking about STIs can be a little embarrassing for some folks, and it's hard to talk about, but I think having that open communication and normalizing it is super important. So like I said before, talking to your partners about it beforehand or even after, it's not about mistrust or not trusting each other. It's, you're showing that you care for somebody when you go get checked for STIs, and also for yourself too. You're keeping yourself safe. So it's super important to get tested and have that communication with your partner or partners and your provider.
Perfect. I love that.
Mhm.
Thank you, ladies, so much. We really appreciate you sharing your time and your expertise with us. This was very informative. And as we've learned, STIs are common and they're manageable and they're preventable, but only if we talk about them and we get tested
Yes.
and we take steps to protect ourselves and others. We hope that today's conversations have helped inform and empower you to make choices that support your sexual health. Thank you to you, our viewers, for tuning in to this Ask the Experts. If you'd like to learn more about sexual health services, STI testing, or HIV prevention programs, please visit wellness.mwhc.com or contact our wellness program at 540-374-3279. Be sure to follow the Mary Washington Healthcare Facebook page and other social media channels to stay informed about upcoming health events, services, and expert advice. Thank you again for joining us. Stay safe and be well.
Thank you. Bye,
You.
guys.